Hello, this is Mark Garrett, co-owner at National Senior Savings with another Medicare Learning module. This will be module number 3, What Medicare Advantage Plan is Best for Me or Best for You. The Medicare Minute and National Senior Savings bring this to you together. Medicare Minute is our podcast. You can find it on iTunes or Google Play Music. So what types Medicare Advantage plans are there? There's basically 6 types you can choose from, and 2 that are probably the most common that people choose from. So there's an HMO, Health Maintenance Organization, a PPO, Preferred Provider Organization, PFFS, which is a private fee for service, SMP, which is a special needs plan, hmo-pos, which is an HMO with a point of service, and MSA, Medical Savings Account. So the first one we're going to talk about is an HMO. Everybody's familiar with HMOs. They've been around for a long time. And HMOs tend to deliver benefits to you at a low cost because you're agreeing to stay within that network. So, can you get your health care from any doctor or healthcare provider or hospital? No. Generally, you get your care and services from doctors, healthcare providers, and hospitals. They're in the plans network. The only exception to that is emergency care or urgent care or dialysis out of the area. So let's say you lived in North Carolina and you traveled to see your sister in Kansas and you were there for a month. If you had an emergent situation or you had to go to the urgent care, if you were a person receiving dialysis, you'd be able to get those treatments done there. But for regular general care, going to see another primary care physician or specialist, you would need to be back in your network. So, do you need to choose a primary care doctor? And the short answer is yes, you do. You must choose a primary care doctor at the time that you join the plan because they're going to see about your care kind of as the gatekeeper, knowing what's going on with you and your health concerns. Do you have to get a referral to see a specialist? And once again, the answer is yes. The reason why you get a referral is because your primary care physician, if it's something he can't treat, he needs to write the referral for you to go see another physician like an orthopedic surgeon or a cardiologist. And they also send you for MRIs, CAT scans, other testing that needs to be done, and it all comes from your primary care physician, your PCP. With a PPO, Preferred Provider Organization, can you get your health care from any doctor, other healthcare provider, or hospital? And the short answer is yes. Do keep in mind that PPOs do have network doctors, just like an HMO does, and other healthcare providers and hospitals in that network, that you usually are going to get things at a lower cost if that's who you see or their preferred providers in their network. But you can go out of network, and if you do, you just pay the difference between what it would have cost to go see a network physician and what it costs to see the provider who is not in network. You do not have to choose a primary care doctor with this plan, and you do not have to get a referral to see a specialist. So, what that means is you can pick up the phone once you look through the doctors. And if you see one that's a network, you can just pick up the phone and call them and say, "Man, my knee's really been bothering me," and they will set up an appointment to see you. I will tell you a little secret though. A lot of times, if you do have a primary care physician you see and you are having a problem, they actually can get you in quicker sometimes to see specialists than you could on your own by picking up the phone and calling them. So you really need to use your primary care doctor and his office staff to your advantage. Private fee for service, PFFS. So we don't see as much of these in the market. They are there. Can you get your health care from any doctor, healthcare provider, or hospital? And you can go to any Medicare approved doctor, healthcare provider, or hospital that accepts the plan's payment terms and agrees to treat you. So let's say that you had something that needed to be treated. You had a infection, bronchitis, and you need to go to a pulmonologist. Well, that pulmonologist would have to agree to accept the terms of your plan for you to go to him. Now, you can go out of network, but once again, if you go out of network, they have to accept the plan's terms and you may pay more. Do you need to choose a primary care doctor? No. And do you need to have a referral to see a specialist? No. You can pick those once again like a PPO on your own. So after that comes a special needs plan, and this only applies to a certain population. So these are people that have chronic ailments like congestive heart failure or COPD, or kidney disease. They tend to be special needs plans, and they have chronic plans designed specifically for them. They also tend to be in a special needs plan. They're dual eligible people that have Medicare and Medicaid both. And what they do is they get a lot of benefits with very little out of pocket cost to them, if any. And that's what they get because Medicare and Medicaid are providing this for them. It is very similar to an HMO. You do need to choose a primary care physician, and you do need to get a referral to see a specialist. So yes, special needs plans have a lot of extra benefits built into them, usually tailored very much for the individual needs of that person. But at the same time, you're going to be just like an HMO. You're going to have to get your referrals, and you're going to have a primary care physician. Then you have the HMO point of service, the POS. So these are HMO plans, and they allow you to get some services out of network for a higher copayment. You still need a primary care physician, and you generally need to get referrals. So I have some clients that are on POSs, and they're good plans, but you have to take into consideration if you decide to go to a physician that's not in the network, you use the POS point of service option. Most of the time, you have to get approval from the insurance carrier itself for you to go to that physician. And at that time, you'll know what your copayment would be too if it was extra than what you would have gotten by using a network doctor. So the last thing that we'll talk about is medical savings account. And these plans combine a high deductible health plan with a bank account. Medicare itself deposits money into the account. It's usually going to be less than that high deductible. And you can use the money to pay for your healthcare services during the year. MSA plans don't offer Medicare drug coverage. So if you want drug coverage, you're going to have to get a plan outside of the MSA. So most of your Medicare Advantage plans, the great majority of them, have the drug part built into it. But with the medical savings account, that's not the case. And if you want to have a prescription drug plan Part D, you're going to have to get that separately. So what I want to go over is which plan is best for you. So it really depends on your lifestyle and your budget. So if you travel a lot, like snowbirds, people who live up north and migrate south for the winter, a PPO or a PFFS might be a great option for you. Because with a PPO, you can see doctors down in Florida or wherever you might go to for a 6-month period of time. PFFS, you can do the same thing with that. It gives you that travel option. PPOs tend to cost a little bit more money on the monthly premium, and a lot of times they have a higher out-of-pocket cost. But they also afford you the ability to do things that you want to do and not be hindered by a network like an HMO gives you. If you like to be in complete control of which providers you use, a PPO or a PFFS is a good choice because both the PPO and the PFFS allow you to choose physicians at your own liking. The only thing you're responsible for is paying a difference in price if they are not a contracted network provider with the insurance carrier that you use. If saving money with some extra benefits, you might look at an HMO or an HMO POS. HMOs are great because they have little to no copayments for the PCP visits. They have very little copayments for your specialist. They keep the price of everything down, but they're very strict on the network that you have to stay within. So an HMO is a really good choice for people that are on a budget, that are looking for some extra benefits, and they're willing to work within that network that's provided for them. If you have a chronic condition or you also have Medicaid, an SMP is a good choice for you. So with a special needs plan, you need to talk to the insurance carrier or to your local broker. And if you have Medicaid or you have a chronic condition like congestive heart failure that you're being treated for, you need to ask them, do they have a plan that's designated for your chronic condition or for you being on Medicare and Medicaid, which those are called dual eligible plans. So in summary, there are many types of Medicare Advantage plans to choose from. We saw 6 that we went over today. You're best served by speaking with the independent broker to help you find a plan that fits your needs, because they can shop the market and they know the ins and the outs of all the different plans. Because, like we talked about in the previous module, there are 2,200 Medicare Advantage plans in the United States. It's hard enough for brokers to keep up with that amount of plans that they can choose from in each state, city, and county. It's nearly impossible for the general public to keep up with that. Not all types of plans will be available in certain areas. So there are some rural areas where I have clients that maybe are in a Medicare supplement with me, and the reason why they chose a Medicare supplement is there simply was not a Medicare Advantage plan of any type offered in their area. Remember, Medicare Advantage plans depend on having a access to a group of physicians or hospitals in the near locale so that they can build a network. When you live in a rural area, you really don't have that option. By choosing a Medicare Advantage plan, you got to keep in mind you're agreeing to work within the network providers to get your health care at a reduced cost. So, all in all, there's a plan for everybody out there. You can choose which works best for you, and the nice thing about it is if a plan's not working for you this year and you have different benefits or changes in your life or circumstances that come up, you always have the ability to change the next year. There are even special circumstances if you move from one location to another. That creates a special enrollment period, and you can actually change your plan at that time. So once again, I thank you for being here. I always encourage you to speak to an independent broker, someone who doesn't work specifically for the companies. They work for you, and they can write you with all the companies because they're going to give you the most options to move forward. If you like this video, I ask you to subscribe. We're putting out new material all the time. Please take a listen to our Medicare Minute, the Medicare Minute podcast at iTunes or over on Google Play. And like this video if you found it helpful and it's answered some of the questions you might have. Thank you.